ultrasound differential diagnosis of abortions. If we think about different types of abortions, the first abortion which comes to my mind is threatened abortion. And if we look at the picture here, you can see this is how we scan, and this is closed cervical os, and we can see the vagina here. This is vaginal orifice, vaginal opening. The external os, then comes the internal os. This is the cervical canal. Typical clinical and sonographic findings of threatened abortion are very important. The term normal outcome is the threatened abortion. And clinically, we usually have vaginal bleeding, clots, rarely closed cervical os. When we do serial beta HCG levels, we can get normal exponential rise. And on ultrasound findings, embryo with cardiac activity, there will be empty gestational sac, 5 to 6.5 weeks, that subsequently develops embryo with cardiac activity. Whenever there is a complete abortion, it is abnormal outcome. Clinical sign will be complete passage of embryo and gestational tissues. The serial beta HCG levels will fall rapidly, and on ultrasound, it will be empty uterus. In threatened abortion, we saw that embryo with cardiac activity is there. The empty sac, gestational sac, 5 to 6.5 weeks, that subsequently develops embryo with cardiac activity can be present. But there is threat of abortion because of vaginal bleeding, clots rarely, but the cervical os is closed. It means nothing has passed out, nothing has gone, but there is threat because of vaginal bleeding. That's why we call it threatened abortion. Whereas in complete abortion, the uterus will be empty and there will be rapid fall of serial beta HCG levels. Whenever there is incomplete abortion, we can get sac inside. The patient can come with lower abdominal pain, bleeding or spotting, with clots or without clots. We can get disorganized echogenic debris with some fluid inside. Residual trophoblastic debris is also seen in most of the cases. So in incomplete abortion, incomplete passage of gestational tissues, we can see that there will be some of the particles, some of the pieces, or some of the contents of gestation will be there, and we can see empty sac, irregular sac, or some RPOCs, retained pieces of conception inside. Then the serial beta HCG levels, they fall slowly or plateau is seen. On ultrasound, typically thickened and irregular endometrium or fluid within endometrial cavity is seen. Then is abortion in progress. When we don't have complete abortion, but it is in progress, patient will have bleeding, often with clots and uterine cramps. It can result into incomplete abortion or complete abortion. We don't know at that stage when it is in the progress. So serial beta HCG levels are variable. Usually plateau is seen, and ultrasound findings are gestational sac in the process of expulsion. That is abortion in progress. Possible causes of spontaneous abortion are fetal factors, chromosomal abnormalities, some of the anomalies, we can have endocrine factors or diabetes